My name is Dr. Michael Bergstein. I'm an assistant clinical professor of otolaryngology, head and neck surgery at the Mount Sinai School of Medicine and a senior attending at both Northern Westchester Hospital as well as Phelps Hospital. The point of today is for us to talk about balloon sinuplasty. I choose balloon sinuplasty. It's as effective as sinus surgery. We do it in the office. It opens up your blocked sinuses. Very quick recovery with lasting relief. This is again a typical sinus. This is a sinus that has some congestion in it, and what we're doing is we're placing a balloon into the sinus itself, which is obstructed, relieving the obstruction, and as a consequence we then have a clear sinus once again. The normal drainage to the sinus is restored. Sinus is an air-filled cavity surrounded by bone. What we want to do is we want to place a catheter, expand the balloon, and the balloon stays in for approximately 5 seconds and then it's removed. It doesn't stay in there. So this would be a sinus from a typical skull on a patient. And what we're doing is we're taking a balloon and we're placing it into the sinus itself and leaving it there for 5 seconds and then just removing it. Now this procedure is done on an ambulatory basis, meaning that patients will come into the office, sit down with a little topical anesthesia. We can pass the balloon. The procedure itself takes probably about 25 minutes, and you go home the same day. Recovery from a balloon sinuplasty is typically less than 1 day, meaning that patients oftentimes will go to work the same day if they've had the procedure in the morning. The number of pain reliever medications that patients need is often 0, and if they need a slight pain reliever, Motrin or Advil, or even Tylenol for that matter, is usually effective. In terms of our efficacy, the efficacy is approximately 85% with virtually no blood loss whatsoever. So patients by and large are extremely happy to the extent that we can do this in our office and you don't need to go to the operating room itself. At ENT and Allergy Associates in our office in Yorktown as well as in Sleepy Hollow, we've been performing balloon sinuplasty for approximately 10 years. The results have been quite remarkable and the procedure itself is revolutionary with a minimal amount of pain and virtually no downtime whatsoever. I would encourage you to speak with your sinus doctor about balloon sinuplasty if you've been experiencing persistent headache and sinus pressure as well as perhaps repeated sinus infections. If you have any questions whatsoever, we're available in our office in Yorktown as well as in Sleepy Hollow at 914-631-3053. Thank you. In our next video, we will be performing a balloon sinuplasty on an actual patient. You'll be able to see the ease of technique and the minimal discomfort that the patient will incur. We look forward to seeing you then.